of the Center for Community Resilience, Promoting Health and Wellbeing Across the Lifespan. This is our national policy agenda series, and we're very excited to be able to share with you one of the essential building blocks of our national agenda around child welfare, foster care, and child well-being. Just to reinforce why this topic is so important with regard to the work that we do at the Center for Community Resilience, I want to put a few things in context here. 3 million children every year are subjected to a child welfare investigation in this country. That means that 3 million children are being put through the stress and the trauma of the threat of being separated from family, that homes are being searched, that neighbors, family, friends are being interrogated, that sometimes this is happening based on anonymous or unfounded accusations. Now, we understand that child welfare at its intent is a system designed to protect, at least by mission, our children and our families. But all too often, at the hands of child welfare, it is doing the exact opposite, and disproportionately so to families of color. And so by that means, and for that reason, we have chosen for the child welfare and foster care system to be considered one of the essential building blocks of community resilience. And we're very excited today to be able to share that topic with you. Just a quick reminder for those who are first joining one of the Center for Community Resilience's policy webinars. This is part of our work that we do across the country with 2 national networks, the Building Community Resilience Network and the Resilience Catalyst in Public Health work. Our work is rooted in fostering equity, oftentimes with the voice and the wisdom of community members. And our policy lab takes this work from our community members and the innovations that they develop and help to inform policy at both the state and federal level. We have a suite of tools that we make available to anyone, including you, that helps to build off of the work that we've done with communities, the successes in policy and in practice change. That includes a one-pager that also details more about our policy agenda, the Building Community Resilience approach, understanding how we communicate and how we collaborate with our partners across multiple sectors, and our coalition building and communications guide that really gives from the street experiences on how to communicate equity across multiple sectors, and our policy and advocacy guide. These are all tools that are free for you to download from our website. Again, our work is based on our national network from Washington State all the way to Florida and all points in between, so that when we are bringing these policy recommendations and the lessons learned, they are truly coming from innovators, much like yourself, from across the country. And so the reason why, as I said before, why we have these building blocks for community resilience is that when we define resilience, it's not just this idea that individuals should be able to bounce back from trauma, but it's also the understanding that we have to be very intentional in creating and preventing trauma, for creating pathways to prevent trauma, but also putting in place intentionally the supports and resources that community needs to bounce forward and thrive. These include supports around child health, maternal health, education, childcare, workplace policy, healthcare, child nutrition, reproductive justice, and today's topic around foster care and child welfare. And so I also want to preview a little bit about why this is such a pressing issue with regard to equity. As we say, it's not just the adverse childhood experience of family separation, it's the context in which it occurs, the pair of ACEs. And we know from research that systematically, Black and Hispanic and Indigenous families are 2 times more likely to be investigated for child neglect compared to their white peers. And why would that be? Well, when we look at the soil, we understand that systemic racism in the form of bias in reporting, but also poverty being considered as neglect, poor housing, and food insecurity are some of the reasons why many families are reported. those living in poverty have more contact with mandatory reporters, increasing the likelihood of being subjected to investigation. In 2019, 75% of cases did not actually involve abuse or neglect, or rather, they were being referred on allegations of the state by state-defined neglect, which means issues linked to poverty, housing, food insecurity, working long hours to make ends meet. Again, if we put in place the resources and supports that families need, then perhaps we could also lessen what were many of the referrals for child welfare. So thinking about prevention, thinking about working with families and communities to identify those supports that are needed is really at the heart of the work that we're going to talk about today. How do we help child welfare systems respond to circumstances of poverty without child removal? How do we work with Black and Indigenous families who disproportionately face removal charges? Well, we have to first understand that family regulation and policing are not actually child welfare in practice, that they really are in practice family separation, a crisis in our communities, a family separation, not just at the border, but what's happening in our local communities. So I'm very happy to be able to talk about this work and one of the innovative approaches that's happening in New York City. Today, we are joined by Jess Danhauser, the Commissioner of the Administration of Children's Services in New York City. Nora McCarthy is the founder and director of the NYC Family Policy Project, a policy and research organization. And Jasmine Wally is the director of policy and advocacy for JMACforFamilies. JMACforFamilies is a nonprofit organization working to dismantle the family policing system while simultaneously investing in community support that keeps families together. This collaboration is innovative in itself because we understand that family health and well-being is supported by policies that not only strengthen individual families, but also investments that address neighborhood conditions that affect family life. In New York City, intentional efforts are being made to reduce families' interaction with the traditional child protection system by providing resources and supports to families up front. And of course, that requires a very strong linkage to community themselves. And that's where Lorelei Vargas comes in. She is the Chief Community Impact Officer of Trinity Church Wall Street, where she has developed and led a place-based initiative to focus holistically on addressing the well-being of communities across New York City. Lorelei will present the process of this work, specifically how her office engaged the community in informing the area of well-being that is most important to them at this time, and how they transform grant-making process to meet the needs of community. So today's speakers help us to understand from a systems point of view, how we approach innovative practice change and systems change, but also thinking about our community partners and the role for philanthropy and actually helping to meet the needs for our community. So I'm going to turn it over to our first speaker, Jess.
Thank you, Wendy. Wonderful to be with you all this morning and this afternoon, depending on where you are in the country. I'm going to do a little bit to frame where we are today and then try to leave more time for the other panelists who are really doing a lot of the thinking about how we might structure family services in New York City in a way that is most accessible and most impactful for families. At ACS, we are the child welfare agency for the city of New York. We are responsible for the child protective system. We are responsible for the preventive services system, foster care system, and juvenile justice system. We also play a key role in the city's child care system as we are currently structured. It is an explicit goal of the administration to narrow the front door of the child welfare system. We have been successful to a certain extent to reduce the number of children coming into foster care. There was a steep decline during the pandemic. And we have kept that number of children coming into foster care over the past couple of years at a much reduced level. We also had a tradition here in the city that we wanted to undo, of bringing lots of families to court for supervision by the court and by our agency when we were concerned around a lack of compliance. We've been able to reduce the number of families that we're bringing to court for supervision by about 40%. This is actually lower than even the the 2020 year that was the height of the pandemic. And so we're seeing, with greater discretion and sort of additional planning with families, we are able to reduce those deeper end systems. We've been less successful in reducing unnecessary reports in the first place. We receive between 50 and 60,000 reports a year. It went down dramatically during the pandemic by about 20%, but has come back up and has sort of leveled off around 10% lower than pre-pandemic levels. And so we are still, in the investigations that we do, we're finding maltreatment less than 30% of the investigations that we do. We've been successful in expanding our differential response, which is more of a family assessment that's done collectively, and a service response and an investigation that doesn't lead a track record, a record of indication, but we would rather those not be calls in the first place. So we are doing work with our city partners, most aggressively in partnership with New York City Public Schools. So we have retrained all of the school liaisons. We've met with the superintendents. We've had sessions with principals, including one this morning, to help them really understand how to access supports without a call to the state census registry. For too long, and ACS has been at the heart of this, we've said, when in doubt, report. So if you see a family, a child's not coming to school, or there's another struggle in the family, call us and let us figure that out. We're switching that along with the state and doing new mandated reporter training that's really clear that if parents are exercising a minimum degree of care, our job is to get them help. And we want to make sure that calls to the state gender registry are when people are truly worried that a child's in danger. So we want to see a significant decrease in those unnecessary reports, and we are building towards that. We're also doing work with our Department of Homeless Services, so our shelter providers, our health and hospitals, because that is a key source of many reports, and a number of other systems to get the word out that there are ways to access support. We have been also building some additional supports. We've dramatically increased the availability of childcare subsidies for low-income families, and have been able to successfully lobby the state to reduce the cost to families dramatically, most about $1 a week. It's the lowest allowed by federal law. And we've also been expanding family enrichment centers, which families have been coming to. It's voluntary. There's no case associated with it. But I say that in the same breath as I'll say we are concerned that ACS is the primary deliverer of those services. We know that families are reluctant to engage with services that are associated with the child welfare system for reasons that are both historic and current. And as long as we have the power of removal, there will always be some concern that engaging with ACS means engaging with a threat. We will continue to make our work more and more family friendly, but that does not mean we need to do all of the work. So we've been talking to advocates, including Jasmine at JMAC and Nora and others, about ways we might envision a different structure to family services in New York. We're looking at examples that they've created, whether that be mutual aid, and we're looking at what should be the appropriate structures for public investment in family services so that families trust coming to them. This is work that we're going to be doing over the course of the next year or two to really understand and think through ways in which we can structure this. Our deputy mayor has been an active participant and leader in this discussion. And so I will pause there and kick it back to you, Wendy, so that we can have time to hear more from other panelists.
Well, thank you, Jess. And really, truly, the idea that you are narrowing the front door of the child welfare system is good news for my first start there. I do want to hand it over to Nora and Jasmine, who've been working with community to define and prioritize those needs that you alluded to in your talk. So Jasmine and Nora, do you want to take on?
Sure, I can start. Well, first of all, thank you for having me. My name is Jasmine Wally. I'm the Director of Policy and Advocacy at JMACforFamilies, which is a nonprofit. We do legislative advocacy around the family policing system, and we also provide programming for parents and young adults who've been impacted by the system. I want to start by, really framing us with the mindset that, budgets are a moral document. And we can really see how society values and approaches this idea of child welfare through the way that state funding, federal funding, local funding, approaches this idea of child welfare. And, federal funding, state funding primarily uses this child welfare funding in investigative processes, separation, adoptive subsidies, and not really seeing child welfare as this upstream kind of support. Even though we know from decades of research that anti-poverty programs work, childcare subsidies, housing subsidies, Medicaid, concrete supports all decrease reports of child maltreatment. Even increasing the minimum wage by $1 decreases reports of maltreatment by 10%. And the child tax credit, the earned income tax credit, all decrease reports of child maltreatment. And yet, when we think about child welfare funding, the primary focus of child welfare on a federal level and on a state level is this investigatory process, and is largely spent on this system apparatus. So like I said, investigations, separations, placement in foster care, court administration costs, and even programs, anti-poverty programs like TANF, which is supposed to provide cash subsidies for families. In states like New York, 7% of TANF funding is spent on child welfare. But in states like Texas, up to 40% of TANF funding is spent on child welfare. So even these existing programs that are supposedly designed to help low-income families, is being redirected into this apparatus that is based around separating and investigating families. So that's kind of the framing of this Child and Family Wellbeing Fund, away from this idea of preventive services and towards this idea of promoting well-being. And, on this note of preventive services, the framing of preventive services is, troublesome in itself. And I think any good policymaker, when you look at a system or a policy, you want to see the underlying assumptions that are being made about this policy. And when we think about preventive services, what is the underlying message of that? The underlying message that I hear when I think of preventive is, unless the government or an agency intervenes in this family's life, abuse or neglect is bound to happen, right? This government agency or this government support has to intervene to prevent this, this epidemic or this abuse or neglect that will happen unless we intervene. So that really frames the ways that services are interacting with families, right? If you are applying for a job and you get a job at this preventive service agency, you are a preventive specialist. You go into a family's home, the way that you approach your work, the way that you interpret things in that home, the way that you approach, your interactions with these families are framed around this idea that you are part of this agency that is preventing child abuse or neglect. That, that families feel that impacts the ways that, people are, service workers are providing support. and ACS workers themselves in a report that they themselves, conducted on themselves, found that they themselves find that, this is a predatory system that preys on Black and brown families, right? So this framing of preventive services sets both the system workers up and the families up for a, distrusting relationship. But when we reframe this idea away from preventive and towards this, promoting well-being, promoting health, right? Promoting child and family well-being, that shifts the approach, that shifts the types of services that get funded, that shifts the way that, we interpret what is child welfare. And I always give this example because I think it really demonstrates the different, how class impacts the types of child well-being services that a community has. In affluent families or in affluent communities, if you ask a kid, what is a coach? Who are your coaches in your life? They might say a soccer coach, a summer camp counselor, public speaking coach, right? If you go into a foster family or you go into a low income family or neighborhood and you ask what types of coaches are here, they'll say a therapeutic behavioral coach, a parent coach, a mental health counselor, right? The way that we approach what is child well-being, in affluent families, we have services or programs that nurture creativity, that build relationship between peers, that build these trusting relationships with adults. But in low-income communities, the types of coaches, the types of counseling are these services that, you have caseworkers coming into the home to color with kids. You have, short-term mental health services that last 6 months, because that's what's reimbursable. So the way that we approach child welfare really differs, and we don't give low-income families the same definition of well-being that we do for more affluent families. So that's the framing of this Child and Family Wellbeing Fund, is how do we promote all the things that makes communities whole, all the things that make families whole, and all the things that promote child welfare, that go beyond the standard services, the standard mental health services, substance abuse services that typically are provided under this funding, but more so what really makes families whole, what really makes communities vibrant, what really builds trust between children and adults, that aren't these service providers. And there are thousands of local groups, grassroots groups that are already doing this work. There are hundreds, thousands of activists who are really embedded in their communities, who are doing mutual aid, who are, I'm thinking of Tanisha Grant and Parents Supporting Parents in New York, who is providing laptops to kids, who is building relationships with families and supporting families, with needs as they come up, but are chronically underfunded, chronically locked out of state funding because state funding is so complicated to obtain, chronically locked out of philanthropic funding because writing grants is really hard, especially if you don't have, a nonprofit backing. And a lot of these groups that are really doing this work and are really embedded in the community don't have this nonprofit status. And they don't have boards of board members that look like the people who are writing the grants, right? So this fund, is really targeted towards how do we increase funding for these existing groups? And how do we build capacity within these existing groups to continue doing the work? And to Jess's point, a lot of these groups are not mandated reporters. They're not part of this system. They are trusted by the community. So this is really about diverting funding away from a system that, as just said, is designed to investigate families, is designed to, has historically and continues to separate families. And so how do we get funding into communities to really, divert away from this system and towards child and family well-being? And so with that, I'll pass it to you, Nora.
Thanks so much. I just want to second everything that Jasmine said before I began talking. Jasmine's really speaking about what is the difference between what we know families need and what we are able to accomplish under our current funding structures, and the difficulties that face community groups in being able to access any kind of support, including philanthropy. And so I'm also really excited to hear from Lorelei, who's beginning to address that conundrum as well. The Child and Family Wellbeing Fund is a new fund that did not go into the budget this year in New York City. It's going to be an uphill battle. We asked for $30 million to move state dollars directly to communities that are most highly impacted by the child welfare system, both in New York City and New York State. Some of those communities, as Jess was saying and Jasmine was saying, there's incredible overreporting. There's 1 in 5 families are being impacted by an investigation each year in some neighborhoods, some places more than that. And for Black children especially, those numbers are extraordinarily high. 1 in 10 Black children in 50 different zip codes in New York out of just 160. So the need for a different solution and a different way of supporting families and different ways of just not reporting them. They probably don't need anything. It's really, really important. This Child and Family Wellbeing Fund is structured to do a couple of different things. First, to move dollars to community groups outside of the state and city agency for child welfare. There's so much distrust. There's even distrust of other city agencies and being able to give enough community control to Black neighborhoods and to Black community groups especially, and to all Black and Latino families in New York City that are over-policed. And so looking at how do we not try to address that distrust and soothe that distrust through persuasion, but simply move money outside of state and city structures that have earned that distrust. So the funding would run through a backbone organization that has experience working with small community groups in a capacity building way to be able to access funding and to handle all the incredibly complex reporting needs around how you spend dollars. Secondly, there would be a community anchor organization in each neighborhood. So we conceived of this as starting in 6 to 10 most highly impacted neighborhoods upstate and in New York. And these groups would be organizations that are mid-sized, that have some existing capacity to take on a new significant project, and that are well trusted by their neighbors. And these groups would have the responsibility to develop an advisory board of community members, especially parents and youth impacted by the child welfare system, as well as a participatory process that would engage community members in figuring out what it is they want to do with money. And the advisory committee would make the final decisions. That participatory process, and I can skip ahead, that participatory process would be asset-based community development. That's a process that combines kind of participatory budgeting, collective impact, and grassroots community organizing. The idea around ABCD, which was developed in DePaul University, is that you begin with finding the people and the loose associations and groups that have developed on their own to build community assets and to resolve community needs. And then after that, you invite institutions and organizations into those convenings. And meaning that people on the ground who are already working hard on behalf of their community, usually for free, not only exist, but have the highest understanding and community trust that's needed to develop out plans for their community. And when you get those folks together and you get other players in the community together to map out what already exists in the community, what can be built on just on your own, what can be built on with a small amount of money, and what you really need large dollars in order to accomplish together. And that process would develop proposals that the Community Advisory Board would decide about to fund local groups. And I'll just snap backwards to say, a lot of groups are going to need tremendous technical assistance to build themselves up. We're looking to fund and support groups that don't have a 501c3 status, that don't have a lot of, they're not collecting their receipts, they're not budgeting, they're not used to handling a lot of money, and pulling those folks into their own ability to gather other government and philanthropic supports so that they can build out the work that they do. These are groups that usually have foot traffic. They're people who are already doing the work, but can't do both the work and the money making together. And so we see this as a process that would help to redefine what child welfare means in New York, act as a corrective to everything from, hundreds, but also decades of intentional disinvestment in communities that has resulted in these extraordinary child welfare involvements, direct resources that are not, as Jasmine said, about preventing, but about building, and to directly combat over-policing and build family and community health. I know that I was working with a parent this fall. She was in a health crisis, and she also had a simultaneous child welfare investigation. And she needed all the things that my family needed just a couple of months later when we also were dealing with the health crisis. She needed neighbors to come in and make food for them. She needed people to do shopping. She needed money for groceries. She needed somebody to take her kid out to play at the playground so he wasn't stir crazy in the house while she was not feeling good. She needed people to check on her. She needed somebody to help clean up the house with her every weekend because she couldn't do heavy lifting. She needed all that kind of normal stuff for months. She's a parent who's fairly isolated. She does not have a family background to support her like that. And there's really nobody you can just easily call to say how can you come by or gather some people to come by to do this? My friends helped a lot. Her friends helped. Her kids' friends' parents helped. But she really needed slightly more than that. At the same time, it wasn't a good strategy to ask the child welfare system to provide that. And the child welfare system is not set up to provide that. So there's a really big gap. In her case, she actually got some support from an Orthodox Jewish community group in her neighborhood that started coming by to visit her and do some of those things. So I think we need more of that. We have it. As Jasmine put it, there's tons of people doing this work. They tend to be the least resourced, that have the most difficulty building themselves up to become not systemic, but pervasive. And I'll pass it to Lorelei, who's working on this very problem.
Thank you. I'm going to go ahead and share my slides. So let's see, can everybody see this? Great. Let's do that. So I'm going to talk about this new initiative that Trinity Church Wall Street started just a few years ago. So it's a fairly new division at Trinity. And Trinity, for those of you who are not from New York, is an Episcopal parish located in Lower Manhattan. And we've been there for 325 years. So it's been there for quite some time. And during the pandemic, we did a series of strategic planning work. And one of the things that we really landed on was thinking, how can we be more strategic in how we invest in our community and in our neighborhood? And so this is the intention that came out of that work around neighborhood support. And I just want to kind of lift up a couple of things here. First of all, the goal here is around ensuring child, family, and community well-being. That is the number one goal of the work that we do. Second, we take a place-based approach. So New York City is a pretty big place and the issues are very complex. And we felt that it was important to begin with a focus. And so we are focusing our work on the communities that lie south of 14th Street in Manhattan. And I'll give a little bit of context for that for folks who might be on the call who aren't familiar. Third, the way that we do the work is both by investing, so through grants and financial gifts, and also with on-the-ground support. So in some cases, we roll up our sleeves and partner with other organizations to do the work. And then last, but certainly not least important, is the idea of co-developing the work. So everything that we have done alongside the community in a very intentional way of centering that community voice. So let me talk a little bit about where we're working. So the area that we're working in is takes up 3 community districts. And I just want to call out the difference between Community Districts 1 and 2, and then Community District 3. So you see there, just take a look at the median household income, take a look at some of the poverty data. So you start to see a lot of people don't think that Lower Manhattan, has a fair amount of poverty, but in fact it does. And in fact, 30% of public housing in Manhattan is right along this area here, right along the East River. So this Community District 3 includes Alphabet City, it includes Chinatown, the Two Bridges area. And then here in Community District 1, you have the Financial District, you have Tribeca, and then you have Soho in Community District 2 and the West Village. So very kind of diverse. It's not a large area in terms of miles. It's actually quite a small area, but it's New York City, so it's quite populated, and as you can see, quite diverse. And just to kind of bring the point home on that Community District 3, when you look at heat maps of all of New York City, you rarely see this area kind of pop out because there is such extreme needs in other areas. You would see a Brownsville pop out, you would see an East Harlem pop out. But when you look at this community as a whole, these areas really do pop out. And again, you can see it's the areas that are right along the East River in that Community District 3. So that is, while we work with everyone across Lower Manhattan, this is really where we've been focusing a lot of our efforts. And so the first thing we did was really, we tried to understand what are the issues. And we started doing this work, kind of in the tail end of the pandemic, but we did a very comprehensive needs assessment, and a couple of things kind of floated out from that. First is this cycle, which I don't think is specific to this community, but I think it was important to capture. And that's this relationship between income and education and employment, and the idea that this cycle can be virtuous. So if you have a lot of income, you can access a quality education, which then allows you to access quality employment, which then allows you to make good money. Or it can be vicious. You don't have the income, you're not able to access quality education, not able to access quality employment, you don't make a lot of money. And as you can imagine, this can go on for many, many, many generations. A couple of other things that came out. One is the fact that quality education was really not something that was reachable or accessible to low-income Black and Brown youth. The idea also that quality childcare is just an incredibly important piece to have in place in order for parents to be able to work or advance themselves by going to school. But the thing that really kind of popped out and we heard over and over and over again was mental health. And what we learned from talking with the community, and we talked with residents, we talked with parents of school-age children, we talked with teachers, we talked with providers, we talked with clergy, we talked with leaders in the community. And the one thing that all of them talked about was mental health. And the fact that mental health could really come and And if you're trying to change this cycle from a vicious cycle to a virtuous cycle, mental health could come and interrupt that at any stage of this cycle, at any age, right? So if you're a school-age kid and you're having some mental health issues, that could really, not getting the help that you need could really mean the difference between your being able to succeed in school and ultimately potentially go to college and get a good job and make that money that you need to make in order to break out of the cycle. Same thing if you're working, right? You might lose your job if you're not able to manage your mental health issues. So we heard from everybody. And I remember a mom saying to me, my daughter needs mental health care and I need mental health care. So there was this real kind of understanding towards the end of the pandemic that mental health was important and people were really suffering. And you see here just some of the things that were exacerbating the mental health issues. So one of the things that we did is we brought a team of individuals together that we call our neighborhood council. These are residents, they are nonprofit leaders, they are people who live and work in the community. And we call them our neighborhood council. And we asked them to help us make meaning of this needs assessment, right? So we had the report, then we said, help us make meaning of it. And so I want to talk a little bit about the approach that we've taken to doing the work. So the first is that it's community driven, and there's our neighborhood council. And this neighborhood council truly is our advisory board. We convene them on a regular basis with the goal of advising us in the work that we're doing. And so one of the things that we have had them advise us in, as we knew that we wanted to roll out a grant making strategy, is where should we invest, right? There were a lot of outcomes from the needs assessment, and all of those areas, as you can imagine, are deep areas where we could potentially invest. But we were looking to launch a grant making strategy, and we worked very closely with this neighborhood council, who ultimately landed on mental health and said, can we just call it emotional well-being? Can we not call it mental health? Can we call it emotional well-being so that we're taking a more positive look at how we take care of ourselves emotionally? And so that is what we are doing. The other piece is just partnerships. We don't do any of this work by ourselves. We do it all in partnership. And so you see here just a map of where some of our partners are. And also just an example, so when we heard from the superintendent of District 1 schools that then that's the district that is in Community District 3, that the parent coordinators really were having a tough time managing the complex issues that were being presented to them and needed some help and support. We worked with NYU to get social work interns placed in those schools just to help augment some of that support. So we do a lot of that, just kind of connecting, building relationships, and getting other supports and services in place. We also leverage the resources that we have, and we think beyond. I mean, Trinity has a fair amount of resources that we leverage all the time. But here's a group of ladies. This is Evelyn, Susan, and Mary. They live in the Jacob Reese houses, and they are community activists. They are the roll up your sleeves type of residents that every community needs and deserves. And these women came to us, and they came to us with concern about their unhoused neighbors who were living in the local parks, at the bus stops, on the streets. And they said, can we do something for them? And so we talked with them, and we were able to get warm meals out, as well as items like sleeping bags and blankets and thermal underwear. And these ladies, we've created a delivery point. These ladies come together and they distribute those items to those individuals every week. And then there's the funding piece. And so we have committed 1.5 in grants to support emotional well-being in Lower Manhattan. And I want to say a little bit about the process because, you know, again, we engaged our neighborhood council to tell us what we should be investing in. And so they said, let's focus on emotional well-being. That's what we're doing. But then we also started thinking, we've got to get the money to the community as quickly as possible. Having spent my career in the nonprofit and the government side, I know it can take a long time from the time you see a need to the time you actually get the money to do the work. And so we worked with our vestry. We worked with the council first to develop a plan, and then with our vestry to approve the plan that really balances our stewardship with rapid response. And so some of the changes that we've made to the way that we've typically done philanthropy is we have a very, very streamlined application. It is more about conversation with the organization, and we spend more time kind of in conversation up front, getting kind of clear about what the concept is, what the problem is. And then the application is very short. We went through the application to make sure we're only asking the questions that we need, right? A lot of foundations will ask you a million questions, like tell us about the community, tell us that we know the community. We don't need you to tell us about the community, right? So we really kind of pared that down to minimize the application process. And then we're able to turn it around really from the time we receive an application. It takes about a month to turn the application around and to get the money in the hands of the individuals who need it to do the work. We also have about $500,000 that we're investing in schools to support academic enrichment. And we do that in the same way. It's actually, the turnaround is even faster. And then about $200,000 in gifts of up to $10,000 that we use to fund kind of smaller projects. And then finally, we provide a lot of in-kind support. You know, one example is during the pandemic and since, many of the pantries in the community have been oversubscribed. The cost of food has just skyrocketed. People cannot afford it. And so many pantries reached out to us and said, can you help us? Like we have 20% more people coming through our lines. We even got calls from schools that said, we didn't have a pantry before, but we have a lot of kids who are hungry and who need help. So we opened pantries and we are supplementing pantries. So that's an example of some of the in-kind support that we provide. I'm just going to go through real quick, and I've given you a sense of some of the programming highlights, but these are the buckets, if you will, of the programming that we've been able to do. And again, the programming has really been driven by that needs assessment and by the idea of disrupting that cycle, particularly the vicious cycle. So, you know, alleviating the financial burdens that many families experience in New York City. These two kids here have just received their backpacks. And so I want to just say a little bit about this backpack program, because I think it's actually very unique. We are very intentional about working with the principals of the schools and the teachers for all the grades. And we say, give us the list that you're going to give the parents. So these backpacks don't have one marble notebook and a pen and a pencil and an eraser. These backpacks have, if the kids are supposed to bring scissors, the scissors are in there. The ruler is in there. If you're in 8th grade and you need that scientific calculator is in your backpack. Everything that is on the list that parents will receive is in this backpack. So we're very intentional about not just saying, here's a backpack with some school supplies, but here's a backpack with everything you're going to need to start the school year off strong. And we do that in partnership with all of our District 1 schools, in addition to some Title I high schools in Lower Manhattan. Then we've talked a little bit about emotional well-being, and of course we have the grant making program, but we do other things. This is a forum. we think it's also important to bring people together to share knowledge and information. So we've been doing that, hosting these symposia around emotional well-being and the intersection with food insecurity, spirituality, housing. Then there's, supporting academic enrichment. And these kids here were part of a program that we supported last summer, a summer camp called City Trekkers, in part because school trips are pretty much a thing of the past here in New York City. And many kids grow up never leaving their communities, never being able to have the experience of experiencing New York City. And so we helped to support this program last year. This year, we're doing it again. We are kind of doing it with an emphasis, kind of a two-gen emphasis, helping asylum seeker youth and their families, providing ESOL classes, workforce development programming, and so forth. So not just camp for kids, but also intensive services and advocacy for parents and families. One of the things that we heard from the communities we worked with was that people just wanted to experience joy. They just wanted to smile and laugh and be with their neighbors. And so we do a lot to kind of encourage that, and the kind of small gifts of 10,000 help us support some of these street festivals. This happens to be the Luisida Street Festival, which was started over 30 years ago in the Lower East Side for families who couldn't afford to go on vacation during Memorial Day weekend. And so this festival has taken place every Sunday of Memorial Day weekend for the families in that community. And then finally, I think one of the greatest gifts that we have is our ability to stay incredibly flexible and to be able to respond to emergencies when they happen. And so here we have some of our staff packing for the asylum seekers. New York City has been the recipient of many asylum seekers, and we've been in the forefront of trying to ensure they have what they need as they become our neighbors here in New York City. And so we've been able to do that. I'm just going to end with just a couple of other thoughts. One of the unintended consequences of doing the work has been the relationship building that has happened in doing the work. We have, I think, very successfully created a table where residents come to sit, where leaders come to sit, where policymakers come to sit. And we not only created that table, but we bring them together on a regular basis, and we create experiences for them to get to know each other beyond their professional roles. And what happens with that is that we are kind of creating this community in Lower Manhattan with people who wouldn't ordinarily have been working together, talking about issues, problem solving together, now finally coming together to work together and solve issues together. Thank you.
Thank you, Lorelei. This has just really been a great example of how state and local and philanthropy can come together around child welfare and promoting innovation in child welfare. One of the questions I have for you, Lorelei, when you talk about compassion and joy, sharing and giving compassion and community and building, community cohesion to support joy, those are things that we can find very difficult to measure. And, being a good steward of the funds that you have available for community, can you tell us a little bit more about the streamlining and how are you considering and working to define, what will success look like? And what are some of the anticipated outcomes of the foundation so that we can begin to have some level of measuring what our impact is?
So one of the angles that we've taken on this is, We've been around for 325 years. We have time to measure things. And really, we take our cues from the community. And we find that if we're honest with the community is honest with us. Is this working? Yes, no. If not, what do we need to what do we need to change so that it works? Because everybody's on the same page that they want things to work. They want things to be better. They want to bring the services and supports to the community. You know, one of the things that we've been able to do as we think about how do we measure this is we said, you know, in this first year when we're doing grant making, let's just bring everybody together for a forum at the end of the year. And let's just hear from people about how this has worked for them. And we're taking kind of the long road in thinking about how we might evaluate this work formally. But really, this is about having the relationships with the providers. This is about trusting the people who are doing the work. This is about trusting the community who says, hey, this is what we need. Can we have this? This is really important. And then just giving them the support they need so that they can be successful. So no real magic in that, but really just trusting and centering and providing whatever resources and supports are necessary for them to have the success that we need in the community.
I truly appreciate the perspective of we have time to measure, you know, balancing what we can do over time versus what is needed today and that rapid response that you're able to provide. One other question I had for you is, in thinking about, you know, we just opened up the conversation to let us know that there was a proposal for $30 million that was not funded for this fund for this year, was not put in the budget, which actually reinforces this idea that we need more advocacy from the community's perspective. Can you tell me perhaps the community that you're working with, and particularly the neighborhood council, is there an advocacy role for them in supporting some of this work, not only what Trinity is able to fund, but also the aims for the Wellbeing Fund?
Yeah, so I should add that Trinity has other philanthropic areas, including addressing housing and racial justice. And that work happens across New York City, and it's quite robust. I think one of the things that came out of the needs assessment was this issue around childcare. We were able to put together a policy report on childcare, and we actually put some money towards the group in New York City that is working on advocacy to ensure quality childcare and access to quality childcare. The neighborhood council, while they don't have a formal advocacy role, that's not something that we're opposed to. I think as issues arise that the community feels are important, you know, there's a desire to kind of dig in and see what we as a body can do together. And that's including, you know, Trinity's resources, including this particular group. I'll also say, you know, this neighborhood council, you know, we get, as you can imagine, when you say that you have a grant making program, a lot of people come knocking on your door with their ideas and things that they feel are important. And one of the things that we do is, particularly when a provider does not have experience in the community that we're working in, we'll go to the neighborhood council and have that provider present to them and say to the council, first of all, is this something that we need? Is this something that your community needs? And if so, and if we fund it, what will you do to make it successful? How can we work together to help them as they come into the community to be successful? And so that's kind of advocacy with a small a, but you know, there are kind of decision points for the council, and I think that there is a lot of potential for advocacy, because we know that this work the long game is advocacy, right? And policy change. And so knowing that that's the real long game, the role of the neighborhood council in doing that advocacy is all the more important.
Absolutely. And I'm sure that Nora, Jasmine, and Jess would agree with you with regard to that. And I do want to give Nora, Jess, and Jasmine an opportunity to update us. What is the status of this fund with regard to perhaps, advocating for inclusion in the next budget cycle? And, how are we making the case that, what you describe, housing and food security and these other resources that support well-being are truly a child well-being fund and necessary ingredients that, we don't want to say child abuse prevention, but we know that it lowers those household stressors and provide more positive outcomes for both child and parent. So what are the next plans what are the plans to help to support advocacy for this very important work that you all have designed?
Jasmine, do you want to say, or you want me to say?
This was the first year that we had it in, I think we finalized the proposal by February or so. So it was a very quick turnaround. So we pushed really hard, but we weren't too surprised that it didn't make it onto the budget this year. And I think we have a plan for really engaging different communities of activists this next year, as well as the philanthropic community. And I know, the points that I spoke to, as well as Nora and Jess and Lorelai, really highlight the importance of philanthropy. Especially as we, even looking at the recent bipartisan budget deal in which discretionary funding was limited, right? We see how easily funding for innovative programs like this can be taken away on a federal level. And so that's really where philanthropic organizations can step up, is, supporting these types of, grassroots movements. Nora, I'll pass to you.
Yeah, we'll definitely come and present to the group that you've convened, Lorelai. And our next phase is to branch out, because this was put together by a small group of advocates with a long history around juvenile justice and child welfare. But there's not a lot of people who are against child and family well-being. We just need to educate people that this is an opportunity that they can get involved in.
And I would just say this, this fund, the concept of it is a statewide fund. And so on the city level, we're really doing work to think about how, as I was saying earlier, how we structure family services. We absolutely need support for change at the federal and state level. So many of the reasons that the structure of preventive services, as an example, is really embedded in the funding streams, that it is focused on safety and risk primarily. We're doing a few things using city tax levy to try to open that up and do things differently. But at the same time, we're trying not to fill up that entire canvas, if you will. So we are able to successfully reduce the number of reports and could divert funding on a city level that could support something like this. It'd be wonderful if it could be reimbursed additionally at the state level. So we're trying to think structurally about how to, as we are successful to get funds like this, I assume we're going to be at a federal and state level, how does that really run through a city level so that community has not only sort of input to it, but real ownership over how those are deployed to support families?
Well, I first want to commend all four of you for the work that you're doing, being innovative and testing out new ideas, but most importantly, letting community really rise and lead in this absolutely necessary reform work. So, I do think, and part of the reason why we wanted to share the work that you all are doing is that this is a potential blueprint for other states and other localities, and it definitely needs to be raised up as such. So I'm wishing you all the best of luck and want to thank you again for all that you're doing to, as you said, Jess, narrow that window, narrow that opening for the child welfare system by opening up a world of opportunity for supports and resources that our families need. I think it was either Jasmine or Nora who described those basic supports that all of our family needs, regardless of income level, regardless of education level. And far too often we find that our systems provide the floor as the ceiling for our families that are living in poverty. And let's raise that ceiling for all of our families. And I really look forward to seeing the returns on the investments and the work and the wisdom that you all are putting forth to really help to create more just and equitable environments for our children and families. So thank you so much. And thank you for sharing your work with us today. We'll be back next at the end of the summer in August with our next webinar. This will be one that will have a bit of a congressional preview going into that wacky, can you believe it? We're heading into another wacky national election cycle, but still there is work to be done to protect the interests of our children and families. And we will be back in August with our latest webinar then. In the meantime, stay safe, share the link for this recorded webinar with your friends and advocates. And certainly we will all continue to do what we do best, and that's work on behalf of our children and families across the country. Thank you.